They've been called the silent drivers of behavior and personality. Their molecular fingerprints are on everything from attraction to appetite. Hormones. As we enter our 30s and 40s, our natural hormone levels decrease, potentially leading to weight gain, sleep disorders, and sexual dysfunction, among others. Many of these age-related symptoms are now understood to be caused by easily detected hormone imbalances.
Both men and women, as they get older, begin to lose hormones. Men start losing in their 30s, women in their 20s. Testosterone is the first hormone to go, and when you start losing testosterone, you become more anxious, more irritable, more depressed, gain weight across the midsection, less energy, don't sleep well at night. Women lose their sex drive, guys lose their sexual function. Their performance is not as good. So overall, people just don't do as well if they don't balance their hormones.
While hormone replacement therapy is not new to the medical lexicon, the types and delivery methods are ever evolving.
Basically, there are two types of replacement therapies for hormones, synthetic hormones and bioidentical. Synthetic hormones are chemically altered hormones that are created in a lab. Bioidentical hormones are just that. They're identical to the hormones we make in our body. They're plant-based, typically soy or yam-based, so they work really well in our body because our body recognizes it as natural hormone.
Synthetics come with a whole host of side effects: blood clots, heart attacks, stroke, and breast cancer in women. In men, synthetic hormones have to be converted in the liver. They also have a host of side effects. Bioidentical hormones are just like the ovary and testicle made your whole life. Less side effects, less complications, better results.
Many physicians and their patients are finding that hormone pellet therapy is most effective in providing the benefits of hormone therapy without the roller coaster effect of topicals, injections, or oral modalities.
Well, pellet therapy is using bioidentical hormones in pellet form. Those are compressed hormones. We take 54,000 pounds of pressure, compress a powder that's pure estradiol or pure testosterone into a very small pellet that's the size of a grain of rice. We then place it painlessly back here in the hip, just under the skin. It doesn't hurt going in. You're getting a bioidentical hormone that's there when you need it. So it's not in oil, it's not time released, it's all there as you need it, and it'll last you for 4 to 5 months.
Hormone pellet therapy is so effective because the dosing is highly individualized. It's dosed on parameters of the patient's age, weight, blood levels. There's several things we look at for the dosing. And moreover, once we place that pellet under the skin and your levels get to where they need to be, they last about 4 to 5 months. And so it's highly beneficial for the long-term standpoint for most of our patients.
Pellets are inserted painlessly into the hip, and it's subcutaneous, meaning it goes into the fatty tissue of your hip. Pellets are then placed into a trocar and placed into your hip. There is a small incision, small wound, doesn't require a stitch or anything. It then is released into your body by cardio output. So the faster your heart beats, the more hormone you're going to absorb. It is not like a time release hormone.
After pellets are inserted, patients will notice that they have more energy, sleep better, and feel happier. Muscle mass and bone density will increase while fatty tissue decreases. Patients will also notice increased strength, coordination, and physical performance. They may even see an improvement in skin tone and hair texture, and concentration and memory will improve, as will overall physical and sexual health.
Prior to the hormone therapy, I weighed 300 pounds. I was extremely sedentary. I didn't want to do anything. I had insomnia, had mood swings. After the hormone therapy, after 3.5 years, I've been able to keep the weight off. I'm 220 now. I usually work out at least 20 hours a week. Yesterday I did an hour of insanity workout in the morning, worked dogs all day. That's what I do for a living. And then in the afternoon I rode 20 miles. And being 50 years old and being able to do that day after day was impossible before.
Before I started the therapy, the hormonal therapy, I felt really bad. I had no energy. I felt like that time was getting away from me. The night sweats, the unhappy all the time. After the pellet hormonal therapy, I felt like I had a new life, huge impact on my life. I had the energy, I had the desire to go and enjoy life again, and I feel great.
BioTE Medical is a Texas-based company that has played a significant role in the development of subcutaneous testosterone pellet therapy for men and women. BioTE Medical hormone pellet therapy is the only method of hormone therapy that provides sustained hormone levels throughout the day for up to 4 to 6 months without any roller coaster effect.
The quality of practitioner that BioTE Medical is looking for could be an OB-GYN, could be a family practice doctor, general practitioner, even a cardiologist, someone that is interested in offering their patients an alternative to bad medicine. And what I mean by that is they're interested in fixing the problems and not just putting a Band-Aid on the symptom.
Bioidentical hormone replacement therapy, powered by BioTE, fueled for life. Experience the BioTE difference. Go to biotemedical.com. Did you know that men and women with low testosterone are more likely to suffer from heart disease, high cholesterol, and Alzheimer's? People with low testosterone lack muscle mass and mental focus, as well as suffer from low libido, low energy, and erectile dysfunction in men. Now, here's some great news. Low testosterone is treatable with BioTE Medical Testosterone Pellet Therapy. It's changed the lives of thousands of men and women and can change yours too. Experience the BioTE difference. Go to biotemedical.com.
Well, you may have heard about hormone replacement therapy as a means to treat menopause or andropause, which is a male menopause, to lose weight or help with depression. But today, our experts are here to explain how it could impact couples therapy. Dr. Gary Donovitz is the president and medical director of BioTE Medical. He's also the founder of the Institute for Hormonal Balance, and he's a recognized expert in the field of bioidentical hormones. And then we have Dr. Terry Grossman. He is also an expert in the field, and he's the author of the Baby Boomers Guide to Living Forever. And then your practice is in Golden, right, Dr. Grossman? And then we have Mike Frucciano, who is a patient of BioTE Medical. Welcome, gentlemen. Welcome to Colorado's Best. Now, Dr. Donovitz, let's start with you, because men and women, you know, as we age, our hormones start getting out of balance, and we just don't know what's going on in our world. And we turn to our doctors for help, but so often we're not getting the right kind of help. This is where you come in with BioTE, right?
Well, that's correct. As we age, both men and women start losing testosterone first, and our lives are changing. We don't remember things as well. Our energy level is not good. We lose our sex drive and sexual performance. We start gaining weight around the midsection. Our energy level's not there. We don't sleep as well. So it's a huge problem, and yet they go to the doctor and they get put on antidepressants because they're irritable and they're anxious. It's affecting their life at home, their life at work. It's not good.
Now, and you would say that a lot of that is attributed to a lack of testosterone for men and women, right?
That's correct. Hormone imbalance is a real problem as we get past the 30s for both men and women. Guys start after about 35. Women can start in their late 20s, and they'll become more irritable, more anxious, more depressed, not know where to turn. And the fact of the matter is their hormones are out of balance, and if you balance the hormones, they can regain their life and live the life they want to.
And I've been told, oh, you're low on progesterone, so take a little bit of cream. Right? But I don't know, I don't remember even looking at a testosterone level. I didn't even know I had testosterone. I didn't know women did.
Actually, women make 300 milligrams of testosterone a day. And the problem with creams and pills and synthetics are your hormone levels go up and down like a roller coaster. Women don't do well on a roller coaster ride with their hormones. Yeah. You have to look at the lab. What we use are small bioidentical pellets. In fact, I think we have one here.
This is one right here. This is the tiniest little thing. I hope the camera can come in tight on it. We'll just leave it right where it is, and maybe the camera can zoom in on it. It's a teeny tiny pellet. How does it work? Where does it go?
It's a bioidentical hormone pellet. We have them both in testosterone and estrogen. We can individualize those pellets to each patient. We put them painlessly right back here in the hip. It doesn't hurt, and they last for 4 to 6 months. So you do them a couple of times a year, and you keep your hormones balanced without the roller coaster ride and without the dangerous side effects that you've heard from synthetic hormones. No increase in blood clots, no increase in heart attack or stroke, no increase in breast cancer.
That's incredible, incredible news. And what's even great about this is not just for women, it's also for men. Mike, tell us a little bit about your personal experience with this, if you would, please.
Well, I've been on the pellet therapy now for about 2 years, and a friend of mine from Dallas, he came up and he said, you really need to get on this and try this out. And I said, no. So after talking to me several times, I said, all right, I'll try this out.
You're going to give it a shot.
Yeah, I'll give it a shot. He said,
What were your
energy's
symptoms
low.
before? Yeah, what was
Well, I
going
had low
on?
energy, and around 2 or 3 o'clock in the afternoon, I would just start dragging a little bit.
Right.
And my recovery time when I went to the gym and worked out and went mountain biking and skiing, it would take me 2 or 3 days to recover. I have 2 herniated discs in the back, and it took me a little bit of time. And he said, Mike, he goes, try this out. So immediately, 2 weeks into it, I noticed my mental clarity was better. I was able to focus, and typically I speak in front of groups all the time, and I needed to be extemporaneous and be real quick on my feet.
Right.
So that helped out when I started sleeping better, and all through the night, and it was great. So I woke up, typically before my alarm goes off, and usually I had to drag myself out of bed. And now I get up early and I feel fantastic, full of energy.
Yeah, I mean, your eyes are bright. I mean, you were right here with us. I mean, I think that's what so many of us talk about is like, I just feel like I'm kind of outside of my body. I'm here, but I'm not like, in the moment, in the game. And, I understand the whole fatigue issue. It's like you get up, work out in the morning, you feel like you should be more energized, but instead around 2, 3 o'clock in the afternoon, you crash. Isn't that a really, typical symptom?
Yeah, and that's a problem because when you have low testosterone, you get that afternoon crash. The cool thing about the pellets are the hormones are there when you need them.
They're consistent.
So if you want to work out in the afternoon, then you'll absorb your testosterone. It's all based on cardiac output. When you're active, you'll absorb, and when you're sleeping, you won't. You'll absorb less. That's the way your body functioned throughout the time it was producing testosterone normally.
The right choice, bioidentical hormone replacement therapy. Countless women and men have now made the switch to natural bioidentical hormone therapy. Hormone replacement using pellet therapy has long been preferred in Japan, France, and other European countries. They've been the subjects of many research studies on hormone therapy in which significant health benefits have been reported for both women and men.
I'm able to focus better through my day. I don't get sleepy throughout, noon. I'd feel 3 o'clock like I needed to take a nap, and now I feel great. I don't get tired till around 10 p.m. and my energy levels stay up, and I'm able to go to the gym, work out, and not feel fatigue. And my days are long, so my 6 a.m. start to 10 p.m. finish works very well.
I would say the best thing it's done for me is giving me the energy. And the energy is required to do about anything that I wanted to do. It's also helped me with my weight and keeping my exercise program up.
I didn't realize that I had mood swings until I got the therapy, and everybody noticed something different about me.
BioTE Medical, using what is known as hormone pellet therapy, is widely regarded as one of the world's most effective forms of bioidentical BHRT, a form of hormone replacement that was developed and perfected by Gary Donovitz, MD, an internationally recognized leader in the field of bioidentical hormone replacement therapy.
Hi everyone, I'm Dr. Gary Donovitz. I'm the President and Medical Director for BioTE Medical. I want to talk about hormones and really how hormone balance can give you the ability to be fully present every day, to be productive every day, both financially, emotionally, spiritually, and physically. So what is BioTE therapy? Well, it's one that's going to help your body return to normal hormone balance, a normal physiologic state, like you were before your hormones started waning, which occurs probably in the late 20s in women and early 30s in men.
What could be better than being your best? Here at BioTE, we offer the best in therapy. Pellets are plant-derived and compounded to the identical hormone structure as the hormones made by the ovary and testicle. What are the benefits of BioTE? Helps in the prevention of osteoporosis and the restoration of bone strength, protects against heart disease and stroke, reduces hot flashes and vaginal dryness, builds lean muscle, promotes improvement in cholesterol levels, reduces risk of depression, improves libido, promotes the prevention of senility and Alzheimer's disease, improves sleep, improves mood, concentration, and memory, results in optimal hormone balance with fewer side effects.
My symptoms before I received treatment were loss of bone density and lack of energy and just general not feeling well.
The pellet has made my battle with depression, it's almost a night and day difference.
I had high cholesterol, high blood pressure, loss of energy, and had a lot of night sweats.
Not getting enough rest at night, obviously. Lack of sleep, lack of energy, lack of sleep. Those are probably the main ones.
Tired, moody, irritable.
A lot of anxiety,
stressed, uneasy, and oh my goodness, the hot flashes were just horrible.
I was extremely fatigued. I had low sex drive and what I call foggy brain, where I didn't feel like I could concentrate or think clearly.
I felt like a person running around and running into a wall continuously, not remembering what I'm doing and how to hold on to all that I needed to do. With my business, I have to have the ability to remember details.
I was feeling sleepy during the day, and as I get older, I've been noticing that it's harder to build muscle and work out and lose weight.
Ask your healthcare provider today about BioTE. www.biotemedical.com. What are the goals of BHRT? Alleviate symptoms caused by the natural decrease in hormone production in the body. Reestablish the individual's hormone balance. Provide protective benefits that were originally provided by the body's naturally occurring hormones. Allow the body to age in a healthy, natural manner. What are pellets? Pellets contain a natural plant source of estrogen and testosterone. These pellets, which are smaller than a grain of rice, are then placed in the fatty tissue underneath the skin and act as if an ovary or testicle is present.
Hormone pellets, which I've kind of touched on here throughout my talk, obviously are my favorite form of hormone therapy. Couple of reasons. Number one, the dosing is highly individualized, and this is one of the biggest things that when I met with Dr. Donovitz and started kind of understanding this therapy and got me on a plane to go train further and become a hormone therapy expert, is the individualized dosing. The dosing is specific to the patient, and it's dosed on parameters of you, what your blood levels are, your age, your activity, your weight. There's a lot of factors that go into figuring out what works for you, and then moreover, we go and we retest you about 4, 6, 8 weeks after your hormone pellet implant. We retest you to see how you responded. That's a brilliant concept, right? There's no other hormone therapy that does that.
Patients have found that bioidentical hormone replacement therapy with pellet implants is extremely effective. Implants placed under the skin consistently release small, physiological doses of hormones, providing optimal therapy. Bioidentical hormone replacement therapy using the pellet method has changed the manner women age. In studies, when compared to conventional hormone replacement therapy, pellets have been shown to be extremely effective for relief of menopausal symptoms, maintenance of bone density, restoration of sleep patterns, and improvement in sex drive, libido, sexual response, and performance. Estrogen is a woman's most important hormone. Without hormone replacement therapy, the loss of estrogen puts her at increased risk for osteoporosis, heart disease, colon cancer, Alzheimer's disease, tooth loss, impaired vision, Parkinson's disease, and diabetes. The effect of hormone deficiency on the brain, muscle, bone, heart, and metabolism can be significant without hormone replacement therapy for women and dangerous to long-term health. The brain needs normal amounts of testosterone in balance with estrogen to produce serotonin, which supports emotional balance. When lacking in these hormones, a woman will experience emotional instability that often results in increased anxiety, irritability, sleep disturbances, anger, sadness, and depression. The musculoskeletal system is also adversely affected by the loss of testosterone. By not having bioidentical hormone therapy, the deficiency or imbalance of testosterone can lead to muscle atrophy, osteopenia, osteoporosis, and pain in the muscles and joints.
The pellet hormone therapy is really, it's been incredible for me. It's totally changed my health. It's changed me mentally, emotionally. It's done so many things for me. It's put me back in shape like I've never been before.
It is definitely a life changer in every aspect you can possibly think.
I feel like a new person. I can think clearer, I'm more productive at work. My relationship with my husband has improved significantly. My energy level, not only am I working out, I'm playing softball 3 nights a week, and I just overall feel great.
To get my body to do anything, I had to drag myself around, and now I kind of feel like I'm showing up 100% for my life.
A noticeable increase in energy after the hormone therapy, and it really started to allow me to live my life again.
They gave me a lot of energy, no hot flashes, no achy bones. It just basically makes you feel a lot better.
I stay very busy and I'm pretty high energy anyway, but I've found that since I've had this treatment, it's great. I mean, it really has made a big difference, a lot more energy, and I'm pretty nonstop.
Pellet therapy for men. Testosterone levels begin to decline in men beginning in their early 30s. Most men need to be tested at 40 years of age. Symptoms of testosterone deficiency in men include fatigue, lack of mental acuity, loss of libido, and difficulty achieving or sustaining an erection. It is never too late to benefit from hormone therapy.
My cholesterol went down significantly by like 100 points. Blood pressure is down. Normal's 120 over 80. I was at 144 over 92. Now I'm at 118 over 78. So I've got the blood pressure under control, cholesterol under control. Don't have to take any more medicine. Sleep a little better at night and have more energy.
I have a lot more energy and feel 100% better most of the time.
Ask your healthcare provider today about BioTE. www.biotemedical.com. After pellets are inserted, patients may notice that they have more energy, sleep better, and feel happier. Muscle mass and bone density will increase while fatty tissue decreases. Patients may notice increased strength, coordination, and physical performance. They may see an improvement in skin tone and hair texture. Concentration and memory may improve, as well as overall physical and sexual health. Men's benefits: increases energy, focus, and mental acuity, lean muscle mass, bone density, libido, and sexual performance, erectile function. Decreases fatigue, depression, irritability, anxiety and mood swings, stubborn belly fat, muscle soreness, stiffness, and joint pain. Also provides protection to the brain, heart, and prostate. Women's benefits: increases energy, focus, and mental acuity, lean muscle mass, bone density, libido, and sexual performance. Decreases fatigue, depression, irritability, anxiety and hot flashes, muscle soreness, stiffness, and joint pain. Also provides protection to the brain, heart, and breast.
Well, if somebody's considering treatment and are being skeptical, I would recommend it 100%. I mean, they could come talk to me. I think it would change their life as well. I mean, who wants to have hot treatments? Who wants to have anxiety? Who wants to, before I got the therapy, I had no clue what was happening in my life. I mean, too many symptoms were happening. And now that I've got the treatment, everything is fabulous.
My relationship with my wife's a lot better. It's just hard to explain the difference it makes until you experience it.
Hello, I'm joined today by Dr. Gary Donovitz, president and founder of BioTE Medical, and having just a little bit of a conversation with Dr. Donovitz today regarding bioidentical pellet therapy, specifically testosterone pellet therapy. And we wanted to get a little feel for how you saw the company moving forward, your passion regarding pellet therapy, and just have some questions that people may be wondering and wanted to ask you.
Well, thanks, Dan. I appreciate the chance to answer some questions. You know, it's interesting. When I first started in practice some nearly 30 years ago, we didn't have bioidentical hormones and we didn't have pellet therapy. At least I didn't know about the pellet therapy at that time. I started doing bioidentical hormone therapy back in the 90s. And again, all I had at my disposal was pills and creams and some patches along the way. But most of the patients just weren't satisfied. They weren't getting their hormones balanced, and I had so many patients who didn't feel like themselves, whose lives were just miserable. And then along came the pellets, thanks to a very special patient of mine, who actually told me about the pellets and how they changed her life.
As far as energy, it's just been a real boost to my energy level, so I'm able to exercise more and get more done around the house, and so that's always a plus.
The treatment changed my life. It's allowing me to participate in a lot more strenuous activities. Like I was kind of docile since I retired, but now I'm up exercising an hour a day, 5 days a week, travel playing softball across the country, and it's just made me a lot stronger.
What I like about it is I don't have to worry about taking a pill. I don't have to worry about taking the cream. I get this every 3 to 4 months. The procedure, is minimal. So I think because of the reflection of me. You know, like I said, 2 of my friends have already started on it.
We're going to give you the right kind of hormone. We're not going to use synthetics. We're going to use bioidentical hormones. We want to give you the right amount. The cool thing about BioTE is we're able to deliver individualized dosing through our pellets. That way you're not just one kind of hormone for everybody. We're actually going to make sure you get balanced using the individualized dosing and the right delivery system, which is pellets. It's the only way that you can have constant hormone levels and not have the roller coaster ride that you have with pills and with creams. Remember this, lab work is not age specific, so you have to have an expert in order to figure out what your labs are and know where to treat you. So that's what we do here at BioTE Medical. We know what the right range is by age and where you should be.
It's just excellent. I mean, I don't think I could ever survive without it anymore. I'm hooked.
My overall experience is like, when's the next treatment?
Ask your healthcare provider today about BioTE. www.biotemedical.com.
After you ring in the new year, do you plan to hit the gym or try the latest fad diet or maybe even resort to pills to achieve your New Year's resolution? Well, our next guest says there's something more than body fat and sweat, and power and willpower will help you along your way. Now, joining me this morning is Dr. Gary Donovitz. He's the president and medical director of BioTE Medical. Do you think a lot of people, men and women alike, are out of whack and that's the cause of so many other ailments?
Absolutely. After women get to 25, guys get to 30, they start losing testosterone. As their hormones get out of balance, they don't think as well. They can't lose weight. They get that midsection weight gain. Their sex drive goes down. Sexual performance goes down. Their relationships go down, and their workplace is not near as good as it was.
Okay, but you do come with good news and some gifts. So I see you brought presents for GMT viewers. I will open them for you. And this first one